If the body is already a whole, includes everything, what is holistic or integrative health? Why did we steer away from the whole to start with, anyways? How did this lack of integration and single systems approach impacted our well-being or lack of? Being a whole is not enough. Don't we also need to be functional or, with the better definition, in our optimal health? This headline bears such questions and more, right? But first, let's meet. I'm Bibi Burcu Beba, aka Dr. Bibi, as my patients, clients call me. I'm a doctor of clinical nutrition, a functional nutritionist. In my previous life, I worked as a business and marketing manager in multinational and local companies in Turkey and then in the US. Then, in my mid 30s, we moved to the US. And with the help of an amazing business and passions coach, I discovered my passion as nutrition and adding to people's health. This called for getting back to school and learning what I needed to realize my dreams come true. I went to an extensive health coaching program for a year and a half, then got my master's degree in applied nutrition at Northeastern University, and finally got my doctorate in clinical nutrition at Maryland University of Integrative Health, where I got solid functional health and nutrition-based education. After a national exam and supervised hours, which took me close to a year, I was awarded the certification as a certified nutrition specialist and got my licenses in multiple states as well. I have been helping my clients revamp their health and lives for the last 12 years. I hope I can be of help to you through these series as well. Employee health and well-being is essential for all of us. So I teamed up with Global HR Summit and we created an impactful series that can add to your well-being. I will be meeting you here every day for 15 days before the Global HR Summit on June 5th and 6th. Integrative and functional health has been becoming trendy topics in the recent years, and for a good reason too. As awareness levels rise, the tendency to put a band-aid on the problems goes down and is replaced by the questions such as, why do I keep having the same problems over and over again? Why does my body not fixing itself properly the way it should be? Let's expand those terms a little now. Integrative health and body's being a whole is best represented by one of my dad's jokes. May his soul rest in peace. He had a joke for every situation. So a professor is getting ready for an important operation. He gets all his students around him before the operation and lectures them like, look, listen closely, everyone. This operation is all about spleen. It's causing a huge issue in this patient. I want everyone to focus on it and get it out perfectly to be investigated without a single damage. After the operation is done, he gets out of the operation room with a happy face, gather all his students around him and starts talking. I'm so proud of you all. We had a great, successful operation. The spleen is intact. A student at the back raises his hand. So, how is the patient? He asked. The professor looks puzzled. Well, the spleen is out. He's living. So, we assume fine. So, while this is a simple joke, it's unfortunately true that system-based medical approach may miss the patient as a whole at times. We see the same tests ordered for the same patient by different doctors, or missed issues as specialists may not communicate with each other properly. But you are not only your heart, your hormones, your immune system, your stomach, brain, or neurological system. You are a combination of all your systems and more. I keep telling my patients that the body is like a set of gears, all interacting with each other directly or indirectly. When there's a problem in a gear, whole system gets impacted by it. You might have noticed that people with chronic health issues experience inflammation and inflammation-related bunch of problems. Once the underlying root issue is identified and a therapeutic approach is applied to the system that has the problem, that also triggers an overall healing in the body. So, to sum it up, all organs and systems interact with each other and cannot be considered separately. I also want to underline another important point here. Being disease free does not equate to being healthy and properly well. A good amount of my patients come to me saying all their tests look fine. They don't have a diagnosis, but they don't feel healthy at all. I'm sure even you know such people around you. There could be various reasons behind it. They may not have a problem in clinical disease level, yet your body is aware that there are issues going on and sending you messages as symptoms. When we evaluate the blood work from a functional perspective, I mean the blood work results that seem medically okay from a functional perspective, we understand those subclinical issues or deviations from the optimal health. Sometimes they're trending high values compared to the previous test. Sometimes underlying possible deficiencies or problems that become clear when multiple markers are evaluated together. And sometimes people may be more sensitive and have symptoms even with slightly lower or higher values. When some medical professionals disregard symptoms because tests are normal, or even worse, make a note to discuss it with a psychologist, it kind of makes the patient feel unvalidated and helpless. I actually had a client whose doctor told her that she has autoantibodies for thyroid gland, meaning that her body is attacking her own thyroid gland. But they're not high enough to treat. So there's nothing to do. She can go now and they'll wait until they're high enough. And then they'll start the treatment. Sadly, this point is when functional nutrition would be of highest help for that situation. Luckily for my patient, we started working together right after that, and they never got high enough again. So we are not a compilation of organs and systems. We're beings that interact with their environment on physical, emotional, and energetical or spiritual level. Therefore, integrative health also integrates all those areas. And the answer to how to be in our best optimal self goes beyond physical needs and includes how we can be happier, more peaceful, content, surrounded by correct people and energies to uplift us, and also how we can give back and support our circle and community. Ah, those band-aids. I gotta tell you, I spend most of my life with those band-aids. Why would a teenager walk around with a Ziploc bag of antacids and painkillers? I mean, it's unfortunately not uncommon nowadays either. But back in the days and in Turkey, it was not normal at all. But it was my normal. I would just pop an antacid more often than not, since digestive issues was my another normal. So were severe headaches. I recall my mom requesting an MRI at one point, and all again was normal. When we moved to the US, I was taking antibiotics every other month for my chronic sinusitis. Well, I gotta tell you this one as well. You could actually feel better close to 50 than in your 30s and could get off your chronic sinus issues, headaches, and digestive problems or IBS. Once the root cause is found, triggers are removed, and deficiencies are corrected, I see even more severe issues getting better. Nope, we are not healing the health issues. No healing here. We supply the body with the correct foods, with the correct tools, not only the foods, but also correct tools to fix the issue and remove the roadblock in doing so. Then the body can heal itself. So this way, we can prevent bigger problems down the road as well. When I say this, usually the following question is, but how? And there's no single answer to that, as we're all different with different backgrounds, different health issues, genetic makeup, so our own solutions. One may have their digestive issues due to low stomach acid, other due to the emotions, and another due to the vitamin intake or absorption. Therefore, one cannot solve a variety of issues with one single antacid tablet. It's just a band-aid to silence the symptom. And since we've been talking often about those antacid tablets, let me give you a small info on them as well. While they do a good job of lowering the stomach acid and saving that moment, majority of those problems are not due to high acid in the stomach, but acid in the wrong place, like your esophagus or food pipe, since stomach does a stronger mixing and churning job under low acid conditions. When we lower the acid further, this can create bigger problems for the future. So, small tip for you to keep. Okay, then, is there not a common place to start? Of course, there is. While we're all different, there is one common area we can all share, and this is the food that feeds, nourishes, energizes, grows us, and heals our cells. In their daily journey in our digestive system, from our mouths to the bathroom, they get mechanically broken down in our mouth and mixed in our stomach, which is the fancy blender of our body, broken down to their smallest particles and absorbed into bloodstream in our small intestine. Remaining parts feed our bacteria in our large intestine and also adds to the bulk to form a good shaped stool. I sometimes wonder, how would we eat if we realize and recognize all this hard work that happens inside the body for just the digestion? So the starting point for healing is the digestive system, and the change starts with the foods. The base of functional and integrative health is indeed functional nutrition. So what is functional nutrition? Not the trendy diets, but balanced macronutrients such as proteins, carbs, and fats, balanced micronutrients such as vitamins, minerals, and phyto or plant nutrients. Well balanced is another vague and confusing term as well. What kind of balance? Balance in what? For whom? And the answer is for you. Everyone has a different diet plan based on their health, family history, symptoms, test results, lifestyle, and preferences. Therefore, my balanced diet may look significantly different than yours. Similarly, it should be based on age, hormones, life stage, since a teen would have a very different dietary needs than a mature man, a pregnant lady, a menopausal woman, or a toddler. Therefore, everyone should have a balanced diet plan created and personalized for them and updated regularly as things change and life advances. Also, when I talk about the diet plan, please keep in mind that the word diet comes from the Greek word dieta. That means the way of living. So if you have a diet plan that is not or cannot be your lifestyle, then it should not be your general diet. So how does a lifestyle diet plan look like then? It is not focused on calories, but on nutrient density. Focuses on awareness and quality meals. Colorful, so it has the highest phyto or plant nutrients. Planned for you and your needs. Joyful to prep and eat. Makes you want to keep it for life, not cringe inside. What works for us in such a diet plan is guided by listening to our bodies. Our bodies do actually know what works and doesn't work for us when we listen to them closely. The trick here is to correctly translate body's language to a diet language. And the best way to clear up this language is to clean up our body with clean foods. If you constantly crave carbs, sugar, such as donuts, biscuits, crackers, chocolate, your body probably is not telling you that it needs those, but it needs energy. When energy is supplied by fast burning and fast used up energy sources such as those, your body constantly craves those for a steady source of energy. creating a vicious cycle, unfortunately. Another thing, we need to listen in our bodies are symptoms. Correctly evaluating pain, inflammation, bloating, digestive or skin issues, mental status changes can guide us much better than many functional tests. After 1 month of clean eating in our guided programs, my patients usually report much effective communication with their bodies. Once their diet is cleaned up, their diet habits are even slightly changed, and inflammation is lowered, they can understand what actually their body says much easier. A detailed intake and a comprehensive blood work panel, sometimes targeted functional testing, are also important components to create a customized functional nutrition plan. So many details, right? Hope you enjoy puzzles, because you're invited by your body to solve the biggest puzzle within you, to inward you. And this is an ongoing living puzzle where each step reveals another layer. That kind of like sounds like a movie title, right? And it certainly is not the one you can finish, frame, and display on your wall. But if you're ready for a change, keep following me here. In our collaboration with the Global HR Summit team, I will be meeting you here every 2 weeks before the summit on June 5th and 6th. Stay functionally well.